There are. I'm going to tell you guys that a really good plan in your practice is to buy 2 emasculators. It'll cut your surgery time in half.
Yes.
When you have a situation like we have here, we want to be fast.
Yes.
Okay.
Mine's the same thing. Yes.
Well, you can clamp one while you're working on the other one. You need to get some drugs in this horse. Greg, you need some help?
You're going to go in this side.
That's fine. You're good anesthetist. Let us know already.
I'm going to go put a neck rope on it.
Okay.
The other side.
All right. What are you going to do?
We initially were going to say 4 cc's of xylazine. Do we feel
I think you better hit him harder.
6, like you said.
Okay, my initial one was 1 to 6.
We need to get this horse on the ground. Hold it on. This excitation is what gives you the fun in the surgery.
Okay, we're going to do 6 cc's of xylazine.
Okay.
She's just
So what I'll do is give this for you. So. Oh, buddy.
Sir, sorry, what's your last name?
Touchin.
Touchin, how would I spell that?
Touchin. Oh, you're going to go in this side?
It's easier for me.
Okay.
I'll just.
What?
I think let's. Yeah.
He's going to need a little help.
No, I'll just. So. Jess, come over here. Just go around the gate. I want to talk to you about doing this.
They'll be a little bit drunk, so they may be able to just walk out the big gate over there.
Don't have very good access.
So when you're doing this in a chute, the biggest worry that you have is getting hurt, okay?
Right.
So what I'm gonna do is see what he's gonna do first. This looks pretty good so far. Greg has got this cinched down so that he can't go, but you need to be ready to get your hands out, okay? So I'm left-handed, so I what you want to try to do is I gently ease it into them. A lot of times they're so wound up they can't even tell that you've been in. Okay.
You're in?
So the big thing too is try not to let them get to this point. Hurry through this initial induction, because a lot of times they'll blow through these drugs like water.
What did you give him?
We gave him
4.5?
No, we upped it a little bit.
6.
Six and 1.5.
Okay. And you
Jess, now you need to be ready to get your catheter stuff ready, so probably the way he's acting will this sedation, depending on what he does with it, will dictate what we do with our ketamine. Okay. Jess, what's your dose of ketamine predicated on?
Usually their weight and their attitude,
Okay.
and the degree of sedation that they get.
Good. So if you're not content with the sedation, what are you going to do? A minute ago.
Yeah. We can just do a co-induction, so do ketamine midazolam to give them a
You could
little
do
extra.
that. You could do that. The other option would be to give him more
To give
xylazine.
him a little bump of xylazine.
Yeah. So what you really need to do now is focus on how is he responding to what your dose is.
Okay. He seems quieter.
Yeah. So the ideal sedation is when this horse
Puts his head down and his lips are a little loose.
Also, you want to watch for the hind limb bounce. So that ataxia, when they're going like that, means that he's probably ready for ketamine.
Okay.
What happens if he's not ready for ketamine and you give it?
It's gonna probably make him a little excitatory.
Yeah.
And may get him out of that xylazine sedation.
What does that mean for you as far as administration of that?
Get out of the way.
No, it means bolus it.
Okay.
Don't just slow IV.
Okay. Give him.
That's why we do a catheter, so you know you're there.
Right.
Bolus it.
Okay.
Okay. But the smart vet stands back here and waits for that horse to become sedate.
Okay.
The busy dumb vet that looks like this guy
No.
says we can go for it, and so be patient and wait for it.
Okay,
Yeah.
that's working pretty good. He settled down nicely. You need more before he gets induced?
Pardon?
I'm asking.
Okay.
Does he need more before you induce?
Ooh, is that empty?
Yeah.
Talking to that old guy with the horse, he said after you cut him, you're supposed to throw a saddle on him and ride him 3 or 4 miles.
Yeah, I know. My personal feeling is I like to emasculate him
Okay.
because I want that crush.
Okay.
When you just strip them off, they bleed.
Right.
And I think when you're starting out, the client impression is when that horse gets up and he's drip, 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 drip. That's not good to start with. So I always like to emasculate them.
Okay.
You can tear them off; they're fine. But for me, I think getting them in your emasculators, as long as you don't have a whole bunch of fascia and a bunch of junk in there with it, is the way to go.
Okay.
What are you going to do if you accidentally open up that vaginal tunic? You're going to do it closed, right?
That was my goal.
Okay.
But if I open
If you open it, are you freaked out?
No.
Good. You just strip around it. If it's not a big hole, you still have it closed. You just strip down and get it done. Okay. If it's a big hole, you're going to change from a closed to an open and do it that way. Okay. Again, it's all about dealing with cards as they're dealt to you. You've gloved up before you?
Oh yeah.
Okay. I mean, you can kick me if I'm,
No.
asking questions.
It's a fair question.
But it's always in front of like 10 people that you're like, where's
It
that
looked like you don't know what you're doing.
Make sure you have
Come
a towel in your hands, in your pocket, so that your hands are super dry.
Okay.
Now's a good time to sneak up and look at him and make sure that you got 2 testicles while he's sedate, okay? Remember, he did get a little torb, but he's mostly xylazine. So what does that mean for you around his hind end?
He could be wobbly.
No. With xylazine, it potentiates speed as far as kicking, and they're hyper-reactive around their hind end. So Amanda's not in a good place right now. So what I would do is sneak up between Jesse and Amanda and just take a look and see what you got, okay? Assure yourself that that's what we have.
I know that this isn't sterile, but as much as we can, we're keeping it very sterile. Yeah. So once you take the shield off,
Good. You feel like, or you know?
It looks like two. I can see the left one very well,
Okay.
and then it looks like the right one isn't down quite as far, but
Good. Well, that's pretty normal. But again, no, you got to know. And then, because that's one more thing that you guys would talk about. If this thing was a high flanker, then hey, you know what? Maybe let's add a little midazolam to the cocktail and lengthen this procedure out a little bit. I generally don't ever do crips in the country, ever, because I think that through painful experience, something that you think is right there generally isn't. And where does that testicle start embryologically?
up in the abdomen
Where?
next to the kidneys.
Yeah. So that's a long road. So a true crypt, that testicle could be right next to the kidney or anywhere along what's the name of the ligament that pulls it into the scrotum?
Oh my gosh.
It rhymes with tubernaculum.
It is the gubernaculum?
No, gubernaculum. So
Like you're rhyming.
so it can be anywhere along that tract. So when I'm doing crips, I always bring them to the hospital because if you run out of anesthesia, then shame on you.
Right.
But if you're in a hospital setting, you can throw them on the gas or triple drip or whatever and do a good job.
What if the owner says, can't you just take the one you see? Look at the other one later?
If you can't get them both, don't even bother.
Right. And I've done that and felt proud about it. Just lay them down and Neil and I made an incision a couple years ago on the Hopi because we thought we could see it. Turned out to be a fat pad.
Oh,
Let them
nice.
up. So. So the good news here is that this horse is handleable in terms of bringing him out. So be ready with your leg rub. The other thing about handling this thing is be neat and tidy about the end of your rope and stuff so that you're not doing
This?
well. I've stepped through a loop and it's not a good feeling when you both go down at the same time. Okay, so this is the loop that you want over his back, okay? So do just what Allison's doing here. Put that loop in your left hand. Good. And again, I think stay as close to that left elbow with your hip as you can. And then I find out a lot about a horse, how he reacts to my hand. Was he in a open top?
He's in a GMC with a red trailer over there.
Okay, that's 3.
Okay, so we've got
Two.
somebody else.
Two.
Itself, so that we all get on the same page. Okay. And then we can start doing it.
Okay. That is the information I was looking for.
Do you know, since we were supposed to have so many today, are the same group of students staying here, or did you want us to kind of...
No, I want you guys to stay here because what we'll do is You guys will both get probably 6 colts.
Okay.
What we'll do is switch midstream, and whoever's doing anesthesia will do
Okay.
castration. So I think there's 12 or 15 today. So
Also, one guy bringing 9, so
Yeah.
we'll see how many
Yeah.
it's in his trailer.
Fair enough.
so if they're ready to come out,
I'd say 9.
so you guys should be talking. I don't know where Jessie went. There she is. Okay. So what's she doing right now?
What you doing, Jesse?
Don't ask.
We're gonna get an additional 2 cc's of xylazine, just to.
You guys should know that though, by what this horse is doing, that they're topping off. When he comes out, so get next to Greg. Okay.
Brought you for.
Thank you so much.
You mind if I watch?
Not a bit. Come on in.
Betsy, do over and kind of assess it, and then we might.
Okay, so what you want to do is you want to find out how this colt is to be around. So see what I'm doing? My hand is always on him and I'm close, okay? And you just gently roll that over, okay? I would wait, see what I mean? Don't come at him like that. Just calmly, quietly come up.
Let's go 2 more xylazine.
Go like that, okay? When you come at me like that, I'm a little nervous. Okay?
How much are you weighing him as? What are you
I'm saying 750.
Okay, so 8 mils with bandages.
Oh, there's a horse coming to your left, guys.
Watch your back, Fran. So Caitlyn, you want that just barely above the ground, okay? Good. So you got everything in your left hand, okay? With your right hand, when you guys are ready to go down, you're going to assist them to ease that horse over. Don't push him until that horse is ready to go down. If you push on him, what'll happen right now? What's that?
Would it stimulate him?
No, he would lean into you and then he'd fall this way. So what you want to do is wait till he's really bouncy and they've got a hold of his head, and then you gently ease him to the right, okay?
And if you're like in between that extra
Sarah, do we have more
No, that's a great question. Yeah.
Be careful with his penis when you're down. It'd be really easy to cut it with the rope when you're pulling it up. So you need to have eyes on that, okay? Two things. That thing needs to be on the inside of his stifle, and you don't want to cut his penis. After that, it's downhill.
That's where I'm gonna be like, yeah, I know. Move fast. That's better.
Are you guys happy with his sedation now? Okay.
So you guys ready to drop it?
We are ready.
Okay.
Thank you for bringing that horse in. This is her first castration. You're going to let her grab some confidence and run with it.
Okay,
Thank you.
that's fine. I'm good with it.
We only have 12 vets watching her. She can't mess up, right?
Right.
We're also going to do a microchip and Coggins on this horse too.
Okay. Do we have Coggins tubes?
I don't think so. Your singular focus needs to be on this horse. There's a lot of shit happening around you.
I haven't even paid attention to any of that.
Good, and don't. You need to listen to that guy, but the bottom line is, the art of this anesthesia is shutting out all the noise, because there's a lot usually,
Yeah.
especially on these. So watch his feet, Caitlyn. Good. Now throw the rope. Throw that whole rope over his back. Now don't get in there. Carefully reach as far as you can. Okay. Now make a loop like I showed you. Put it on the down leg.
We have a box. Bring our stuff closer.
On the pastern. Needs to be below the fetlock. And it needs to be pretty tight, okay? Now, remember, this kick radius is like that. So you go like that. Now you need to pull that up in his flank. Pull hard. Pull.
Yeah, hard. Get that leg big. Break it up. Yeah.
There you go. Keep coming. Now, keep coming. Now look over and tell me if you're happy with the way that rope is.
No, because it needs to be medial to.
All right. So with your left hand, come around his butt a little bit. Keep tension. Keep tension always. With your left hand, pull it up over that stifle. Pull. Good. Now pull more tension. As tight as you can.
Leg day, arm day, and a back day.
Now, with your right hand, maintain the tension. With your left hand, reach across and get this up leg. When you do that, your hand is like this, and your face is kind of like this, okay? This is where he's gonna get you. Pull it up to you like this, okay? What that does is, if you reach around, first thing you're gonna see is his hoof. If you go like this, he's gonna knock that into you and it's gonna feel better, okay? Do it. Keep that tension. Keep your face away from that. Now, with your right hand, take that rope up medial to the stifle, medial to the pastern.
Heart rate 52.
Good. In the pastern. Now pull down hard. Pull down. This is where the safety part. Now take a dolly. Keep this and take a wrap around the pastern. Good. Now with this, with your right hand, hold onto his foot. With your left hand, maintaining, go around his hock with a figure 8. Another figure 8. And then a dally, okay? I always put my dally up pretty high so that why don't you come hold this for me, okay? Your horse, your rules. All right? So I want you to keep that about there. Don't put too much pressure on it. Let's get scrubbing. We're done. All right? Keep your ring on. It's good. Come on, let's go. So this is time management right here, okay? So you want a good first scrub, one scrub, okay? With soap. Remember, where are your incisions? All right, so you want to start there and work around, okay? Get some soap on that. No, just with the squirt bottle. Grab that squirt bottle. Throw that on the ground. That never goes back in the bucket. Okay, so here's what I do. Put some soap on there. Now really scrub, okay? We have lots of alcohol too, so.
Be generous.
All right, now, when you are blocking this horse, you're left-handed or right-handed?
I'm right-handed.
So with your left hand, you need to exteriorize both of those testicles from the front to the back, okay? Keep good tension on them. The further you can pull them down into the scrotum, the better off it's going to be, okay? Now, let go of one of them and keep the other one, okay? Now, exteriorize it some more. You should be squeezing really hard here, okay? So that you know that you have just spermatic cord in your O here, okay? Direct that right into your palm, okay? So you want to be about like that, okay? Suck it back, give it. Good. Now do the same thing, only grab the up testicle. So if you, wait a minute, so if you get in the practice of doing both of them at the same time, do that. Good, bring them both up, and then drop the bottom one this time. Good. All right, really exteriorize that so you know, okay? Here's where you get in trouble blocking, is if you're not exteriorizing it, then it's going to be tough to go. So you want to be about like that and go right down in that cord. You should feel that needle kind of between your fingers, okay? Good. Now let's go ahead and scrub, scrub, scrub.
Everybody's gonna have a horse, so you just think about your gloves.
From that rope.
You want the round one or you can get a new one? Collect it out for that reason.
My finger would cover it. Yeah. That's what it was doing. Alright, so with your left hand, you're going to find that median raphe, our nice little line. Put it in your fingers and lift it up as high as you can. Yep. Yep. And then you want your doyen to be as low on that tissue as you can. So maybe a little bit bigger bite.
Yeah, bigger bite and pull more.
Yep.
Here's the thing about retracting that is that you're going to keep all that other shit out of your way. So pull up and bite.
Perfect.
Good. Now get your blade.
Oh, you want two or just one?
I think it's good.
Okay.
Yep. You want to? There's some right there.
Remember, it's a smooth.
I want you to walk back and get a blade holder. I want you to practice with a blade holder, always. I think you can be more intentional and more careful with a blade holder, okay?
You doing good? Yes. Okay.
He said he's next. Good. So elevate that and cut it off nicely against the doyen.
Motion. Cutting. Follow that plane. It's a little tough, right? He's had 4 years to have it. Now it's ours. Heart rate still 60. Almost there. Going.
And if you get to the point where, yeah,
Yep, there you go. Intentional with your cuts. There you go. It's all coming off. There we go.
try to take a more 90 angle on that. You're getting some sub-Q stuff there now, so just, now come up with your blade. Turn around and come up with your blade. There you go. Good.
With your left hand, just throw it on the ground.
Get that over there.
Back down. Go ahead and take our doyens off. I'll take those for you. Put it back. Go ahead and work on getting your testicle out.
Yeah, you all need to come back.
You want some sterile process, please?
All right, so what you want to do, see that right there? You don't want to mess with that, all right? So with your dominant hand, you need to be stripping that down, okay? So get the fascia off of there first. So all this stuff, you got to work off. Good.
It's going to be slippery, so hold tight with that left hand. I have some gauze if you want it. Give you a little bit more purchase on that tissue.
So all of this fascia needs to come off of that if you're going to do a closed castration, okay?
Here you go. Help you get.
See what you pulled out with your index finger there? Don't want that. See that? So you need to be behind that, okay? So start at the epididymis and make a hole. I'm gonna get some eights.
Some what?
Eights.
Really grasp that left. Yes, exactly.
Thanks.
All of that's gonna go. All that clear shiny stuff. Like a sleeve, like you're picking up a sleeve. There you go. There we go. Usually once you strip it down at the epididymis, it makes it a little easier to hold on to, and then you should work towards his body. There you go.
Good. So now with your dominant hand, make an O here. So I break this all down under here. Now, make an O and push down there, okay?
You said with my dominant hand or
Either
does it
way,
matter?
either way. You need to really make a tight O there, okay? Good, good. Let me see. So, that's good. All right, let's get the other one done. Once you make your window, perfect, perfect. That's good. Now, once you make your window in that fascia, just keep working it up, just like that. What's your heart rate?
I don't know.
Her ring can tell us later. It's off, so it can't.
You're doing good. You're doing good. All right. So once you get underneath that fascia, good. Now, yeah, take that plane and work it.
How's team anesthesia doing?
Very good.
That was perfect.
Good. Now, look at the hind end of that thing. You still have a lot of fascia back there. So what I like to do is stick my thumb in it and push. See how I'm doing that? I'm just pushing, okay? Go.
Is that him pulling the leg or you? Okay. We had one leg movement anesthesia, but I think we're still good.
Okay.
And then the O again?
You're not ready yet. So see all this fascia? You need to be underneath it, okay? See how I did that?
Yep.
Do it. You want to see nice white vaginal tunic and that cream ester, okay? You still have a little bit there. You see that? Okay. It's all right though. All right, let's go ahead and see that fascia right there. We got to break it down a little bit there. All right, go get your emasculators.
Do you want both of them?
Nope.
Just start with this one.
Nut to nut. Good. Nut to nut. First thing you do is make sure your equipment's properly maintained, okay? So is this tight?
Yes.
All right. So open them as wide as they'll go. This is the cutting thing.
Okay.
When you're crushing, don't touch this ever.
Okay.
These are the only two things you got to worry about. Okay. I'm gonna help you exteriorize this.
Okay.
Let's do the bottom one first. It's easier. Okay. Now we'll go this way. All right. So you do not want to emasculate a horse ever down here, right? Why?
Because you could still have testicular tissue in there.
Sure. And the other thing is, the more cord you take out, the less likelihood that you'll have a sciurus cord afterwards. So with your left hand, come under here, like I am, and get that skin away from where you want to be. Now put the jaws on. Now with your one hand, just gently close them until you're happy. Okay, that's good. Now you're not quite perpendicular, okay? You're twisted a little, so go like that. Now, go back with both hands, and with one strong intentional motion, get down where you got some leverage. Go. Okay, it needs to engage the ratchet, okay? Don't touch the ratchet. Just keep ratcheting it down, okay? Now go get a hemostat. 2 minutes, please. Get a good one. There's a couple of curved bigger ones. Okay. So with this one you want to tag, but you don't want to occlude. So flip them over, because you want that to slide in that way. Okay. All right. So get a good tag on that. Not that big. Good. Tag it. Now go get the other emasculators. Do you want these testicles? Yeah. Okay. Out in front? Okay. So with the same thing, with your left hand, bring it up so you know that you don't have anything underneath there, okay?
Did somebody start 2 minutes?
Yes.
Yeah. Okay.
Make sure that you don't have any skin in there, okay? Now get your emasculators on there. Did you check them, make sure you're okay?
I did.
All right. Now again, with your right hand only, just clamp until you can't. Until you're there. All right, stop. Now, good, strong, intentional, hard. Go. Good. Try not to touch that. Very good. Now go back one more time and clamp again. If you can't get another one, that's fine. Now do this one again. That's good. All right, let's go ahead and tag this one. Turn them around. You want to turn them around. There you go.
This way?
No, other way. There you go. Now slide up there. Good. Now while we're waiting, let's go ahead and cut these. When you're cutting them, never ever get around that area, okay? Same thing here. You want to just cut. You don't want to mess with his clamp at all. All right? So go ahead and clamp. Okay? Go.
Thank you. Coming at you.
Let's go ahead and do the other one while you're here. Okay? Go.
There's another one.
All right. Now, I got this sponge, but I don't want you in there poking around, okay? Just daub so that you can kind of see how things are looking. How you feeling right now?
Pretty good.
Yeah, real good.
It looks good.
Yeah. So you have no blood coming, right? Where's this blood coming from?
The skin.
Good. So now what? You need to tell this man a 2-minute joke. Maybe off color.
Funny.
Well, then tell him a story.
Once upon a time.
Actually, this is a good time to start your aftercare instructions, because he's pretty much focused on what you're doing because he's scared shitless you're going to kill his horse.
That's That is not going to happen.
It's not going to happen. So, but seriously, this is a good time to start talking to him about how we manage this horse after, okay? You want to give this plenty of time. How's this horse's anesthesia right now?
Seems good on my end.
Yeah, so he's good. So when you do this by yourself in the field, where are you going to be watching? Two places. Nope, it's too far away. Where are you going to be looking? You're going to look here. Lots of blood, lots of bright blood. Going to get up. This is where I watch, right here. What's his respirations doing? Are they deep and angry? No. They're calm and quiet. So you know that you're in a good plane of anesthesia, okay? So those are the two things I watch when I'm doing this by myself. It's the longest 2 minutes of your life.
It's like sedation minutes.
Yeah, it is. It's just like that. Good job so far. Now, when you take these off, you have to be as intentional as when you put them on. So with your left hand, you're going to come up through the ratchet like this, with two on each side. With your right hand, you're going to be here. Remember, don't get anywhere near those. Okay? When you open these, this part cannot move. What you want to see is that cord to gently fall out of those jaws, okay? Gently. Don't pull, don't rip, okay? If you disrupt the emasculation or the clamp that you have on there now, you're going to wish you hadn't.
Right.
Okay? We about good? All right, let's go ahead and get them off, okay? So which one was the first one you did? Good. The other one. All right. So with your right hand, provide pressure across here to get the ratchet off. Try not to move that at all. Good. Now keep that. That's your fulcrum. Move this over here. No, move this, the hand over here. You have this. Now gently open them without moving that. Open. Pull this. Perfect. Awesome. Now, let's go ahead and take that bottom one off.
What do you need?
We're good.
Are we done with this?
Yep.
Yep.
So use this, wait, so you haven't popped it yet, right? So move this hand clear over here and squeeze till you get that off. Now move that hand back to the right one, good, and gently open it. Pull with your right a little more. Good. Ideally, Caitlyn, you want these to be this open when it comes out, okay? So, but that was good. Now,
Done with those?
yep. Now, let's look and see how you're doing. So gently, with your left hand, look. Gently. You happy?
Yep.
You see the stump?
Yep.
All right. So when you take this off, you do the same thing. You pop them with both hands, and you open wide. You don't pull ever. Okay? Now open it. Keep opening it. Good. Perfect. Same thing here. Don't be pawing. Just look. Just open it just enough to look. You good?
I don't know. I've never searched for it.
Okay. Good. All right. Now you're done, right?
Just kind of shrivel up and the body will
You right?
Up a little bit.
Huh?
Do you clean them up a little bit?
take off as much
If you want to. If you want to, a little bit. The thing is, the more pawing that you do, can you open that for me? Just some regular gauze. What I like to do, just from a fly perspective, is get this off. Go get your scissors real quick.
He'll be better now.
See this fascia? probably going to be a problem with healing down the road. So just make sure that you don't have any major vessels in there and cut it off. Okay? Go. Good. Awesome. Let's get out of here. Big thing now is keep your incision clean when you take the rope down. Okay? Get your gloves off. Help this young man with the rope. We'll just gently let that horse down like that. Okay? Now, remember where this horse is going to get you. So get clear around here and get that bottom rope off. What I would do is reach in there with your left hand and just pull the rope. Pull it to you. Good. Now get it off of there. What I like to do now, you could just pull it straight out here, but that's going to wreck your sight. Okay, so what I would do is grab that, go underneath both legs, and then ask for help, and you guys seesaw it out his back legs. Just seesaw it a little bit. Pull, pull. Just keep pulling. Good. Awesome.
Good job.
Perfect.
The world is one Gelding mature.
Okay, so now is a really good time for you to talk to this young man about what you want from this, okay?
I got it. Sorry.
You want those testicles? Okay, I'll get it back. So get the forms, they're over here. There you go. He needs to know this back and forth.
Okay.
Okay?
Can I have it?
Ours there. Actually, yeah, you're right. That's a good one. This one maybe.
This is a big.
What we could do is get Ronnie. Maybe we'll get his running mate. And we can close those, Bailey.